Good morning. I'm Dr. Tyler Hamel, Kingwood chiropractor and nutritionist. Happy Monday morning. Finally, the sun's come out. Just talking with a patient this morning saying how lucky we are that we live in a place like this that for the most part it's always sunny, and the sun kind of brings about positivity and energy, and who doesn't need that, right? Who doesn't want that? So I had a question today about, and this happens, this is a very common question with patients: how long does it take to get better? How long is it going to take for my neck pain or my back pain, sciatica, or headaches to go away? How long is it going to take? So, and it's easy for me to describe as a chiropractor to say, like, hey, these joints in your neck or your back, they're not moving properly, and then speak more detailed language like that, right? The nerve is being pinched or the joint's being irritated. So it's going to take a certain amount of time to undo that, or to make that feel better, or to restore it to the proper function, things like that. Or I can say, well, your posture is over like this. Basically, it's going to take this amount of time to get you back upright this way, right? And so people hear that, or new patients can hear that, but that really doesn't sink in, because the main reason that they're here is that they want to get better so that they can do something else, right? So they're thinking in the back of their mind, well, how long is it going to take for me to be able to lift up my kids again, dress my kids or lift up my kids again, because their back pain's so bad? How long is it going to take before I can sleep soundly throughout the course of the night, right? Sometimes patients with neck pain, back pain, they can't get in a comfortable position, so their sleep is terrible. Not only do they wake up in a lot of pain, but they haven't slept very well. And this can happen for weeks on end or months on end. And when you're not sleeping very well, then that has a big effect on your life. Or how long is it going to take for me to get back in the gym, right? People that are used to going to the gym 3-4 times a week, 5 times a week. Maybe it's CrossFit. Maybe it's a Camp Gladiator. Maybe some other classes where, people are used to going in there, and that's a big part of their stress relief. That's a big part of, of their day sometimes, just getting in there, feeling good, having a hard workout. And now they're not able to do that. So how long is it going to take before I can get back in to the gym? Golfers, the same kind of thing. We live in Kingwood. There's a lot of golf courses, a lot of golfers, and golfers can be used to golfing, 4 times a week, 5 times a week. What if they can't do that anymore? What if it's now 0 times a week? Imagine how that person feels, right? Not very good. If that's you, you know that even missing a day or 2 or a week of golf when you're used to doing it that often, that's really a pain in the butt. What else do patients say? They would say things like, I can't work very well, or I'm not very productive at work, right? If you have a really bad headache every day or neck pain, just think of that. You're trying to get through your work, whether that's on a computer, any other kind of work as well. It's going to be tough to get that done. So these are the real problems, or the real reasons that a patient's coming in, right? Like people might have a little bit of back pain, a little bit of neck pain or a headache, and it's not affecting their life. So that's usually not enough to get them to do something about it. But once they come in to see me, it is affecting their life to a certain degree, and that's why they're coming in, right? They need help. So I tell them, we got to figure out what's causing your problem. If I find that, then I'll give you a solution on how to get from here, say severe neck pain, back pain, can't play with your kids, can't go to work, can't go to the gym, get you from here all the way to here, which is going to be all the opposite of that, right? Now you can play with your kids, you can do whatever you want, go to the gym, golf, and be happy again, right? If you're miserable in pain, it's tough to have much quality of life. You can't do a lot of things, or you have a lot of pain when you're trying to do certain things, or you might not be able to do certain things at all, which is really irritating. So we strive to get patients better in about an 8-week period of time. Some patients are a little bit shorter than that. Some take a little bit longer, just depending on the history. If they've had accidents, if they've had, this problem multiple times before, has it been for 10 years? Has it been for 2 weeks, right? There's other things to consider. But that's what we strive for. So I think, patients want to know that. They want to know, number one, can you help me? Number two, can you get me from point A to point B where I'm at? Like in pain, miserable, not able to do a lot of certain things that they love to do during the day, to getting to no pain so they can do all those things. hobbies, whatever, swimming, playing basketball, golf, traveling. Just think of all the people who are retired who are trying to travel. If you're not healthy enough to get around wherever you're traveling, you're not going to go, right? It's pretty miserable. So that's it in a nutshell. Dr. Tyler Hamel, if you have any questions about chiropractic, about your back pain, neck pain, headaches, sciatica, those are the main 4 things that we see that people are coming in with. We do offer a complimentary consultation, meaning that when you come in, you tell me everything that's going on. And if there's any point in that process that I don't think I can help you, I'll let you know somebody who I think can. If I think I can help you, then we'll do an exam and we'll do a treatment that day. So if you're on the fence, if you're not sure if chiropractic is for you, check out our Google reviews on our Hamel Chiropractic and Wellness. We have over 200 reviews of people coming in with all sorts of different things that are doing very well. I think our treatment plans right now, and as far as our patients, we're getting an 86% improvement within a month worth of treatment, which is pretty darn good. Usually we're somewhere around 75, but right now we're at 86%, meaning that everybody who comes in, the new patients that are coming in, if they go through the process and stick with the treatment plan and the corrective exercises, 86% of them are getting better, and that's a big positive. So give us a call if you like, 281-360-8387. We can talk about it further. Again, if I can.